Welcome to the Candida Chronicles with our host, Michael Biamonte, certified clinical nutritionist. In this podcast, Michael will answer your questions and reveal the shocking truth that the cause of most chronic ailments is not what you've been told. The source is Candida, a yeast overgrowth which, when it becomes systemic, can cause all sorts of seemingly unrelated ailments such as chronic fatigue syndrome and even weight gain. For more information on how Michael can help you, please visit healthtruth.com. That's health-truth.com, or phone his office at 212-587-2330. And now, without further ado, Michael Biamonte.
And good afternoon, everyone. This is Michael Biamonte, clinical nutritionist, and we are on with another episode of the Candida Chronicles. To remind everyone out there, the book, The Candida Chronicles, Volume 1, has been released and is now for sale on Amazon.com. And the companion book to The Candida Chronicles, Volume 1, will be the Candida, we're gonna call it Materia Medica. What Materia Medica essentially means is that it is the book that covers all the materials on the medicines or the medical substances that are used to treat an illness or a disease. So the Candida Materia Medica is going to be a companion book to the first book, Candida Chronicles Volume 1, which will contain all the possible and all the known treatments that can be utilized for Candida. So a person can familiarize himself with these various treatments and see how they would fit into a treatment protocol. I also invite you to visit our new website, health-truth.com. It is the best website we have ever had. And we owe thanks to Harry Trush and his wife Megan Manning, for their great work in putting this website together for us. All right, folks, so today we're going to be discussing the proper treatment for Candida. And this is something which could be somewhat controversial. It will depend on who you talk to. But we're going to lay it out pretty simply here on how Candida should be treated and how it should not be treated. The first rule in treating Candida is to know you have it. And this is where some kind of testing comes in place. Now, we could do an entire podcast, as we have in the past, on Candida testing alone. But nonetheless, you must have some type of a test to guide you through the Candida treatment. Why a test is necessary is, number one, to first validate that you indeed do have Candida, so that you are treating something which is actually there and not something that you're assuming. And number two, so that you can retest from time to time to check your progress and to then confirm when the Candida is gone. Now, many of the conventional tests for Candida all have drawbacks as far as this goes. Stool testing for Candida sounds like a great idea. The problem is it's erratic. If we take a Candida patient who's the worst case of Candida in the world and do a stool test on him every few weeks, you're going to see erratic results. You'll see times where the stool doesn't register Candida. You'll see times where it registers a lot, times where it registers some, time where it again registers a lot, then it registers none. I've been through this in my practice many years ago. We actually did a study in the practice where we had various people submitting stool tests. And we all knew these people had Candida because, number one, they all had either vaginal yeast infections chronically or thrush in their mouth. So we knew they had Candida overgrowth. And the stool results were very inconsistent, to say the least. So stool sounds like a good idea, but it's not a good idea to rely strictly on that. It can be used for checking your friendly flora, which I'm in full agreement with. It's accurate for checking flora, and for bacterial pathogens. For Candida, it's inaccurate. The most accurate stool test, if one is going to use one, is a 3-day test, where they're also using a microscope to look for yeast under the microscope as part of the parasitology. That tends to be more accurate. It doesn't tell you if it's live yeast or dead yeast. They're looking at it, doesn't tell you the yeast species, but it does show pretty well the presence of yeast and the amount. So that's acceptable if you use that and if you are getting a read from it. Blood tests for Candida are pretty much a complete waste of time when you're dealing with conventional blood tests. Most people who do a conventional blood test for Candida are not actually testing for Candida in the blood. They're checking for your antibodies against Candida. This is based on the concept that if your immune system is fighting the Candida correctly, it'll register high antibodies showing it's fighting the Candida. If your immune system has exhausted and is no longer fighting the Candida, then the antibodies could appear to be normal or even low, which it gives you the complete wrong impression of what's actually happening. This is called a false negative. Live blood cell testing for Candida is accurate if the Candida is there in the body and it gets into the blood and it sticks itself to white or red blood cells. The live blood cell testing can show that. But if the Candida is not doing that and it's only in the intestines and it's not entering these blood cells at all, then it will show negative, while you may have a roaring case in your intestinal tract. The conventional spit test that's talked about on the internet is really a test for dysbiosis. If you do that spit test and it shows very positive, that means you have intestinal dysbiosis, which means you could have bacteria overgrowth, Candida overgrowth, parasite overgrowth, or all three. It doesn't specifically tell you which one you have. There are some more advanced blood tests which also measure Candida toxin levels in your blood. If you come across any of those tests, that can be a good test to do. The problem with that test is that it can only be done every 9 months. Because from the time that you eliminate Candida, it takes 9 months for that test then to go negative. So that's more of a one-shot thing. If you do the test that says you have Candida, you know you do, and that's about the usefulness of that test at that point. Of course, at the Biamonte Center, we happen to own a real-time Candida test, which is done by urine, and this urine test tells us the amount of Candida waste product in your urine, which is highly accurate and also explains to us when the person's having die-off. The other urine tests available for Candida would be the organic acid tests, which are usually concentrating on measuring erythritol. The organic acid tests for Candida are helpful, but they're not foolproof because they can also elevate for other reasons, other metabolic problems. On a case-by-case basis, a doctor would have to look at that to determine how accurate it is for Candida on that individual. PCR testing for Candida is available. It's not widely available, but it is becoming available, and that will prove to be the most accurate test for Candida eventually. It's not going to be as comprehensive in helping you understand your response to treatment as the Biamonte Center home urine test, but a PCR test for Candida will be accurate and will be functional. This is a blood test that's done for Candida, looking for DNA of the Candida in your body, particularly in your blood. It's virtually the same thing as the HIV viral load test, only being done for Candida. So, first thing we establish in proper treatment for Candida, there must be some type of a test for us to go by so that we know that we're doing the correct treatment. Testing for leaky gut also now falls into this. There are many people out there, and I've told this story 1,000 times, who will come to my office and say, you know, I've been treating my leaky gut for 10 years and it just hasn't gotten better. I will ask them, have you tested for leaky gut? They will say, no, I'm positive I have it based on the symptoms. We go ahead and test them for leaky gut and they don't have it. So here you have a person who spent 10 years treating himself for something he doesn't have. He's doing it based on symptoms, which is not as accurate as we would like. So for the leaky gut testing, there is the new breath test for leaky gut, which is accurate. And there's also the traditional lactulose mannitol recovery test, which is also accurate. And there is also, the next thing we're going to talk about is the information that was sent out in my newsletter a few weeks ago on transient leaky gut syndrome. And in transient leaky gut, the condition is very interesting because this can be diagnosed by the traditional leaky gut test, the lactulose mannitol recovery test, if the person has their parameters in the yellow on that test, not in the red, but let's say closing in on the red and in the yellow. And if they're symptomatic of leaky gut, you could say that is evidence. If you have a GI effect stool test or a CDSA stool test or any of the comprehensive stool tests, if you have such tests and if the person has elevated fecal IgA accompanied by a low level of butyrine and a low level of total short-chain fatty acids and perhaps an elevated stool pH where the stool pH is above 7.8, this is a pattern for transient leaky gut showing in the stool. So that would also be evidence that you have leaky gut and that would be warranted to treat it. Now, the treatment for leaky gut and for Candida is specific. Leaky gut I can't really get into too much here because unfortunately some of the treatment for leaky gut is proprietary and we've taken years to amass the data on how you treat the different types of leaky gut. There are subtleties there, which unfortunately I can't really get into in the short period of time we have here. The treatment for Candida, as you will read in the Candida Chronicles first volume, is very straight ahead, and there are some obvious rules that one has to follow. The first rule in treating Candida properly is that you must rotate your antifungals. We choose a 4 to 7 day rotation of the antifungals. So normally a person would select 3 or 4 different antifungals and they rotate them 4 days each, and that is your rotation of antifungals to start beating the Candida down. While you're doing that, it's correct that you take some version of the Biamonte Center Phase 0 program, which consists of MSM sulfur and alpha glutamic acid, different forms of enzymes, particularly cellulase, diatomaceous earth, and some type of fiber product which contains not only fiber but clays. This is the essence of the Phase 0 program. And what this essentially does is it helps to remove Candida from the lining of your intestines as you're taking the medicines that are hopefully killing it throughout the body. This also reduces the die-off in the product we call Candilucener. It contains N-acetylglucosamine, MSM sulfur, different enzymes, and molybdenum. And molybdenum is an essential nutrient in helping your body to handle the die-off reactions that you'll get from killing Candida. Molybdenum helps to reduce aldehyde activity, which is one of the things that happens with Candida that causes the symptoms. So there's got to be some kind of Phase 0. You could think of Phase 0, if you want to be very simplistic, as a colon cleanse. So while you're taking the rotated antifungals, you must at the same time take a colon cleanse for the purpose of continuing to expose the Candida in your intestines and to get rid of the Candida waste product so you don't feel horrible. The next rule of a proper Candida program is that you're not going to take probiotics mixed in with the antifungals. Many of the antifungal substances have bad effects on the probiotics, so you're actually wasting your money in that manner. But in the larger sense of the game, the real truth here is that when you take probiotics while the Candida is still present, you're completely wasting your time because the probiotics will not stick to your intestinal lining while you have Candida. That's a hard one to swallow for some people. But that is the truth. All the money that people spend on probiotics is a complete waste of time because probiotics cannot stick to your intestinal lining while Candida is present. So they're literally going in the toilet. Now, there are many people who feel some benefit from the probiotic when they take it because the probiotic is still going to have some beneficial effect. It may help to lower the intestinal pH, which will make you feel better and reduce the activity of Candida. But the basic truth is that even if you're taking a very expensive human strain or sticky strain probiotic, the Candida and the other dysbiosis repels it. You could think of this as being like a game of musical chairs, or even think of it from an electronic viewpoint or magnetic viewpoint. The Candida has a certain charge, the probiotic has a certain charge, and when you aim them at each other, they repel each other. So it's just if you get even a basic book on bifidus or lactobacillus, this is one of the first things you read. So we do not waste the time taking probiotics while we're killing the Candida with a rotation. We take the probiotics with the appropriate prebiotics after the Candida is eliminated, because at that time that is the point when the Candida will stick to the intestines and when it actually will repopulate and you'll get some good use out of it. The second thing regarding probiotics is we do not take them while you have leaky gut. There are special strains of probiotics made by the Metagenics company, which are made for people with leaky gut. That's a whole different story. But generally speaking, if you take probiotics when you have leaky gut, you'll have bad reactions. You'll usually react allergically and have uncomfortable and unpleasant reactions, which actually are going to be making your leaky gut worse. It would be as though you were eating foods you were allergic to that were setting off reactions that were further damaging your leaky gut condition. So these are some of the basic rules that people are constantly violating in Candida treatments. And the next rule we come to is that we do not touch toxic metals while you have Candida. The only time that this should be done is on a case-by-case account where we can deem that the person's toxic metals are so bad that they're preventing any kind of forward progress in any other action that's attempted. Generally speaking, toxic metals feed and aggravate Candida. So if you have Candida and you go on a toxic metal withdrawal program, as those toxic metals come out of your tissues and re-enter your bloodstream and then come into your intestinal tract to be eliminated through your stool, they will be absorbed to a degree by the Candida cells that will spread or literally eat and be nourished by these toxic metals. Candida is known to absorb large amounts of mercury, which it uses as some kind of a nutrient. There was some idiotic rumor years ago that came, I believe, somewhere from the Midwest, that the reason why someone with mercury toxicity developed Candida was a defense mechanism, and the Candida was there to help you by engulfing the mercury to try to keep it away from your system. This is the biggest bunch of nonsense I've ever heard. Study the effects of mercury on your immune system or on your intestinal immune system. It becomes clear at that point that the reason why mercury and Candida flourish together is simply because mercury suppresses your immune response in your intestines, which then allows Candida to grow. A way to look at it would be mercury in your intestinal tract is the same thing as an antibiotic, which kills your friendly bacteria, then allows Candida to grow, and then the Candida absorbs the mercury. It's not doing it because it's trying to help you. It's doing it because in the presence of mercury, Candida grows. It's that simple. When you have Candida and mercury conditions, and you start killing the Candida, it's a very good idea to give the person a product called Metachel. Also, the citrus fruit fibers, like modified citrus pectin, is very good because these substances absorb the Candida in the intestinal tract and the mercury, so they help keep the toxicity down. It's particularly important for the mercury. Killing colonies of Candida, which are holding on to mercury, means as the Candida dies, it releases the mercury. You want to have something there that's going to attract that mercury and prevent it from going back in your body and poisoning you. And that's where the Metachel and the modified citrus pectin come in handy. So we want to address toxic metals only after we've eliminated the majority of the Candida, because we don't want to aggravate the Candida with the toxic metals. And the other case in point, too, is if you study phase 1 and phase 2 detoxification. One of the things that you will learn in studying these two parts of detoxification is that the phase 1 in particular is very dependent on proper intestinal flora in the colon. Your detoxification from the liver, hepatic detoxification, is greatly enhanced when you have proper amounts of bifidus bacteria. If you are deficient in bifidus in your colon, which almost everybody with Candida would have to be by definition, it means you don't detoxify well. So that's a pretty simple way to view this. If your intestinal bacteria is disturbed, you cannot then properly detoxify. It means that your liver is at a disadvantage and your liver doesn't detoxify correctly. Therefore, how do you expect your body to handle the toxic metal detox? That's not going to go too well. So keep this in mind, please, because it's also showing you the most opportune time to do the toxic metal detox, or any detox for that matter, based on the fact that your body is ready and has the ability to properly detox, and it's not being impeded by the Candida. Many people try all types of detoxification while they have Candida, and it doesn't go so well. Well, the reason why is because when you study phase 1 and phase 2 detoxification pathways, and you see how important it is for those pathways to have normal flora in your intestines, you then see why your liver in particular can't detoxify correctly when there's improper flora. So to put a strain of doing some heavy detox on there, or the detox of metals on the liver, when you have bad flora, it will be self-explanatory as why it doesn't work or come out very well. So that means that the next rule is that we do not detox metals until we have gotten our intestinal flora back to normal, because if we do it in that manner, then we know that there's not going to be a problem with the detox backing up on us. So when looking for a Candida program, it's essential that you look for a program that is going to follow these points. The program needs to rotate the antifungals. Now, why? I don't think I went into why that is. One of the most fundamental things you'll learn about Candida is that Candida, like a chameleon, is able to change itself from a fungus to a yeast and trying to eliminate anything that's trying to kill it. It's a self-protective mechanism. This is called dimorphism. It means being able to live in two different states. So when you take a Candida medicine, it's generally agreed upon by most of the textbooks that the Candida will become drug resistant to the medicine you're taking after about 21 days. So continue to take the Candida medicine for 21 days, and around 21 days is where it's going to start to become drug resistant, and the medicine will start to work less and less. This goes back to the old story that you hear from people that they were taking this Candida treatment. It was going really well for a couple of months. Then it stopped working and the Candida came back and was now harder to get rid of than it was the first time. This is your typical example of Candida becoming drug resistant because you took the same medicine every day. I have some fellows who are oncology surgeons who even refuse to give their cancer patients antifungal drugs for more than a week straight without changing the drug for fear of the candida becoming drug resistant to that medication. So while the textbooks are saying 21 days, people in actual practice may have observed that happening even faster. We choose a 4-day rotation because we know that there is no way on God's earth that the microbes can become drug resistant or change in 4 days. Candida diet is the next thing that you must pay attention to. There are a lot of crazy Candida diets out there. At the Biamonte Center, we have Candida diets that are based on the level of Candida that you have. The stricter diets are for people who have higher levels. We have Candida diets based on your blood type, and we have Candida diets based on whether or not you have leaky gut syndrome. Any of these diets are modified or personalized to the individual. Out there in the cyber world, you'll find people have all kinds of crazy ideas about Candida diets based on what's worked for them or what's worked for the majority of their patients. None of it is actually based on looking at it from a more scientific viewpoint. Unfortunately, here is the real big problem, is that a lot of the Candida diets out there are excessively strict. And the reason why they're so excessively strict is because the people administering them have no other technology in eliminating Candida, so they're leaning strictly on the diet. They're going as strict as they can on the diet because there's no other technology that they have of the use of correct use of antifungals or any other type of modality to eliminate the Candida, so they unfortunately have to rely on a very strict diet. Strict diets for Candida will never get rid of Candida, and that's for one basic reason. Candida is a vegetation, and it grows roots into your intestinal tract, and it does that looking for blood vessels so it can get glucose from your blood vessels. If you think of this, it's like your intestinal tract is the peat or the soil. The Candida is the plant, and the roots are growing into the soil, which is your intestinal tract, looking to get glucose out of your blood vessels so the Candida can live. So even if you went on a complete fast and you yourself were not eating anything, because your body in a fasting state is still going to break your muscle down and convert those amino acids into glucose and sugar, the Candida is still going to stay alive even if you ate nothing on a fast. Now, granted, it's not going to be alive in its full volume as it normally would, but enough of it will remain alive so that when you go off the fast, the Candida will go back into bloom, let's say, and go right back to its former self. That said, you still do need a Candida diet, because the idea of the Candida diet is to starve the Candida so that the Candida cannot eat and replicate and be healthy. So, here today we've covered these various concepts of the Candida treatment. I'm trying to give you today the ones that are the most important and the ones that are the usually most neglected. Neglecting these different points on the Candida treatment will cause your Candida to fail. It will not eliminate based on this. If you follow all of these things, you have a good chance of having success in your Candida treatment. This has been Michael Biamonte, clinical nutritionist, with another episode of the Candida Chronicles. Please tune in every Wednesday at 1 p.m., where we will once again tackle another aspect of Candida or Candida-related problems. And I remind you again, please check out the book, The Candida Chronicles, which is our first volume 1 on Candida, available at Amazon.com. You can follow the link from my website to find the book on Amazon, or you can just simply search on Amazon Candida Chronicles. Thank you for joining us. I hope that you've learned something here today from this information, and I hope it's of use to you.
That's a wrap for this episode of the Candida Chronicles featuring Michael Biamonte, certified clinical nutritionist. Michael holds a doctorate of naturopathy and is a New York State certified clinical nutritionist. He is a professional member of the International and American Association of Clinical Nutritionists and of the American College of Nutrition, and he's a member of the Scientific Advisory Board for the Clinical Nutrition Certification Board. For more information on how Michael can help you, please visit healthtruth.com, that's health-truth.com, or phone his office at 212-587-2330.